It is highly recommended that several practice sessions be performed before treating a patient. If the Verruca Freeze insulator is not already in place, carefully slide it over the top of the canister. Remove the safety tab from the top of the nozzle. Place the extender tube firmly into the spray nozzle and test spray the canister by pointing it toward the floor and pulling the trigger mechanism. There are two methods of application for Verruca Freeze: limiting cones and cryo buds. When using the cone application, position the limiting cone on the practice pad. Initially, it is easier to practice with a larger cone. Hold the cone firmly in place and direct the extender tube against the inside wall of the cone. Pull the trigger very lightly and spray until 1/8 to 1/4 inch of cryogen has accumulated in the limiting cone. This will take 3 to 6 seconds depending on the technique used. Continue to hold the limiting cone firmly in place while the cryogen evaporates or boils off. Evaporation should take 20 to 25 seconds and can be both seen and heard. An alternative technique is to drip the cryogen into the cone through the use of intermittent sprays. Remove the cone from the practice pad to reveal the ice ball. Freeze time and the size of the limiting cone determine the size of the ice ball. If no ice ball is visible, the lesion has been underfrozen because less than 1/8 inch of cryogen was used, or evaporation time was less than 20 seconds. As a result, a second or third freeze-thaw cycle would be required. Do not use more than 1/4 inch of cryogen. Excessive use of the cryogen or significantly longer freeze times could freeze excess normal skin tissue or cause temporary nerve damage. The thaw phase, which lasts approximately 40 seconds, begins when the limiting cone is removed from the lesion. It is important to protect the thawing ice ball from touch or heat in order to obtain the most effective freeze. If a thaw time of less than 35 to 40 seconds occurs, or if a large lesion is being treated, repeat the freeze-thaw cycle, increasing the spray time. Repeat the practice sessions using progressively smaller limiting cones until 3 to 6 second spray times and 20 to 25 second evaporation times are consistently achieved. A secondary method of applying Verruca Freeze is by using the cryo buds. Cryo buds are foam tip applicators best used for treating hard-to-reach or bony surfaces of the body, but can be used in place of the limiting cones. Select the appropriate size bud applicator. While holding the canister in one hand and the cryo bud in the other, apply gentle pressure to the trigger nozzle and lightly spray the cryo bud. Saturate the bud to its first drip point. Place the frozen bud onto the practice pad and hold firmly for 25 to 30 seconds. After removing the bud, an ice ball will appear and will thaw in approximately 40 seconds. The cryo buds may be used for multiple lesions on the same patient, but should be discarded after use.